Good to have you with us in this edition of the Urban Debate. Tonight on the prime time, we've got a series of big stories lined up for you. First up, we're going to put the spotlight on the city of Mumbai and the Maharashtra government as well as civic bodies' efforts and why it still may be a long war against Corona as far as Mumbai is concerned. Then we talk about travel during Corona times. Today was day 2. As far as domestic air travel is concerned, things were a little more settled, of course, because by now people know if their flights have been cancelled. But we will focus on what extra precautions should one be taking as we travel and continue to live with COVID-19. The story number 3 is the spotlight on the migrants issue, and unfortunately, viewers, the fight between the state and the centre over trains. 40 trains, 80 trains, 150 trains, your permission, my permission, where is your list? All of that still continues, and it's the migrants who are actually still getting stuck in the middle of this fight. And then, of course, we've got locusts creating havoc in 5 different states. We are going to explain to you just what is happening, why is it happening right now, what could be the impact. So these are the 4 stories that we will focus on. But first up, let's put the spotlight on the city of Mumbai, the city that has now seen over 1,000 deaths since coronavirus hit us. The city that tops the list with the highest number of cases. We have over 31,000 coronavirus cases that have been reported in the city so far. Of course, the number of active cases is a little less. And it's no denying the fact that the biggest challenge in India will be Mumbai. For the fact that we already have a large number of cases, for the fact that it has a huge population and that it is high density population. But viewers, we also have to talk about the steps that have been taken so far. And if those have been enough, if we have been slow, what else needs to be fixed? I will tell you some of the key statistics that actually raise concerns about Mumbai. Recovery rate of Mumbai is 23.7%. The national rate, the rate for the entire country in terms of recovery is 41.61%. We are at 23.7% here in Mumbai. There has been a 6-fold jump in the doubling rate in Dharavi, which is one of the biggest slums in the city, biggest slums in the country. And there is that concern still continues. High density population, like I said, in crowded clusters is a big problem. Positivity rate is at 13.17% versus the national rate of just 4.17%. So number of people who are testing positive as we go about checking is much, much higher in Mumbai. And of course, the fact that 72% of the deaths, these 1,000 deaths that we've seen, have only happened in the month of May goes on to show that there is a rising concern as far as Mumbai is concerned. Now, everybody knows this. We've been constantly talking about it. There has now been enough pressure on the state government and the civic body, enough for them to come out and at least give us a detailed report card on the kind of preparations that are going on. Remember, it's been several weeks since we actually saw the government and civic body officials come out and address the media and share information with us. Today they did. Now, the government and the civic body actually claim that there are 8,000 ICU beds and 3,000 ventilators ready. They also say there are 456 ambulances that are deployed across the city. 84 machines have been made available for dialysis for non-COVID patients as well. There was a massive crunch of dialysis machines and treatment in between when a lot of private hospitals had to be shut down and quarantined and isolated. And for every positive case, BMC says, we are quarantining 15 people in the slum area. That's the kind of step that they are taking. Is this enough? Is a lot more required to be done? How do we really tackle this? Is Mumbai headed towards a massive failure in the midst of other speculation that's going on about the government and the problems within the government itself? These are some of the questions I will ask my experts. But before that, I want to go across to Disha. And Disha has actually been tracking the civic body's steps on ground, how it's working out. Disha, there is one point that we've raised repeatedly of many of the policies and initiatives that were announced but didn't really go anywhere.
Well, that's right, Tanvi. In fact, in the last 3 months, we have seen a lot of policies being announced by the civic body here in concern. But as in when the days passed, we actually saw few of those policies did not really being implemented on the ground level, and if perhaps it happened, then only for a couple of days. For instance, if you talk about the Dharavi, it's the biggest, of course, slum here across the country that we are talking about, and one of the massive step that the BMC had announced was door-to-door thermal screening. They did so for at least a month. They had screened over 45,000 people, but after a month, they just changed that policy altogether entirely, where they said that no door-to-door thermal screening will take place. All the people have to walk into the private clinics or the municipal dispensaries to get themselves checked, if at all, if they have any sort of symptoms. So that was one of the biggest, of course, policy change that we saw the BMC did. And here I'm specifically talking about slum, Tanvi, because now 80% of the positive cases are coming from the slum areas, from the congested pocket lanes. And now, of course, the BMC has to really ensure that those lanes are monitored well. Secondly, if you talk about policy change about the containment zones, Tanvi, firstly, the BMC had actually decided that if there is any positive patient found in one particular society, they used to seal that one society and they used to contain that whole area of that society. But now, of course, that policy has again changed, and the number of containment zones have come down from 2,800 to nearly 644, which essentially means that the number of containment zones have come down, but the areas now have become more. So essentially, they won't target standalone buildings or standalone chawls for that matter, but now they will look at the larger area so that they can have one the entire force put up only in that area, which can really resolve the entire problem. That is one. Secondly, Tanvi, as we all know that slums, of course, is the biggest concern. As we all know that the BMC had also released 8 most COVID hotspot areas in the city of Mumbai, including the slum congested pocket lanes like Dharavi, Baikala, Masgaon, Mahim, Andheri. So all of these are the areas which have maximum slums. So now, of course, one of the policy that the BMC is actually going to start in the coming days is quarantining at least more than 15 high-risk patients behind one positive patient. This, of course, comes little too late, Tanvi, because till now what we know that if any positive patient was found in the slum area, they used to only quarantine 1 or 2 high-risk patient, and the others, of course, were not really quarantined. So this way, of course, this is coming in little late. They are going to quarantine 15 people so that they can contain the spread of this entire virus. So these are few, policy changes that we are looking at in the last 3 months, Tanvi, particularly. As far as the healthcare infrastructure is concerned, the BMC is maintaining that there is no shortage. They have ample number of beds as far as government hospitals are concerned, private hospitals are concerned. They have shared the figure stating there are over and above, if you talk about 75,000 beds available across hospitals, across COVID care centers. That's something that they are very confidently saying that Mumbai is ready to tackle any sort of situation that comes their way.
All right, so that's what the Mumbai Civic body and the government officials are claiming. Thanks, Disha, so much for joining us and summarizing, that news briefing for us as well. Let's say good evening to our panelists. Dr. Mangesh Pate, Chairman for IMA Hospital Board of India for the state of Maharashtra. He's also a member of the IMA National COVID Task Force. Dr. Shashank Joshi, Dean, Indian College of Physicians at Leelavati Hospital. Ram Kadam, MLA and spokesperson of the BJP, and Clyde Crasto, spokesperson for the NCP, joins us this evening. Dr. Pate, let's begin with you. The challenge of Mumbai, the statistics still don't look good. Now, we're being told that our health infrastructure is, prepared well, that we have 8,000 beds and 3,000 ventilators. But will that be enough if cases are, jump up as we gradually also look at a scenario of opening up the city?
Quite some extent, I will say that what virus we are facing here, it is a deadly virus, remember that. And you cannot deal with virus as we deal with the other common cold and other things. We cannot take it so casually. Unfortunately, people have been taking it extremely casually. Last 2 2 months or so, I have been talking to you, Tanvi, and every time I have told that issuing guidelines is there in place, but there is an issue in implementation or obeying the guidelines. This has not been addressed. In one sentence, if I had to address your question, I will just say that last 2 months I have not seen any vigilance committee here. Vigilance committee role is mainly to see that how sternly the guidelines are implemented, whatever are given by the government. Guidelines are coming very rightly. Lockdown has been there. Honorable Prime Minister has declared it. But right from the lockdown number 1, we have failed that. What was expected from us, how to implement it, we did not. People did not listen. We have been telling this time and again. Prime Minister has said, our Maharashtra State Chief Minister has said, every political leader, they have told that social distancing and other norms should be very strictly followed by the people. But unfortunately, today's date, where we stand at the end of the lockdown 4, today also, when I go to the streets, I wonder whether are we
Right.
in the lockdown or not. That is the situation today. And there are many videos which were brought to my notice from Mumbai, few areas in Mumbai, where during lockdown 2 and lockdown 3 also there was so much of a crowd. Last time in your show, there was one video which I had seen. The crowd was as usual when we are roaming around in the Crawford market, that way the crowd was there. Now, in such scenario, if this virus is not going to increase or well, how it is going to decrease, you tell me that. I am asking this question. Thank you.
Okay, I take your point. Let's in fact get Clyde to respond to that. Clyde, and this is a big concern. Even now in many places, we've highlighted instances of sealed areas, containment zones where social distancing norms are not being followed. People are roaming around freely. If we're not able to implement the basics of the lockdown, how will we contain the situation?
See, Tanvi, I heard Dr. Saab saying, and with all due respect to him, he has made some very, very valid points. And I agree with him to quite a big extent, because yes, there are places where people are not listening. But there are two parts to this, what I'd like to say. One is the implementation and one is the people not listening. See, the implementation, the police, the BMC, they all have been out there trying to implement, and they're making sure these things are implemented. But there are people who just don't seem to listen. Now, the point here is, in the beginning, stern action was being taken against these people. That's when it was being politicized, that you're being too strict and too stern. When you're trying to be a little ease on them and trying to explain to them, just like, we need to follow social distancing, then you're saying you're being light on that. I understand what you're trying to say. I mean, people are not listening to Honorable Prime Minister. People are not listening to our seniors. But it's up to the people. It's the onus is on them to understand that this is a severe pandemic. And the only way, one of the important and most major ways to get rid of this is to maintain social distancing, to avoid going out if you do not require. But I would like to tell you, not just because I'm from a party that is part of this government, I'm telling you that I don't think the police or the authorities have left any stone unturned to make sure that the implementation of the guidelines are taking place. Yes, the people are not listening, but we continue to explain to them. We continue to take action, whether it's people not listening, going out on their motorcycles. The motorcycles have been impounded. Cars not going out without reason have been impounded. People have been fined. Those things are happening. And so we will continue to do that. And yes, it is up to us to maintain that social distance.
Okay, Mr. Kadam, do you agree that it's up to the people now to maintain social distancing? There is so much or only so much that the government and the police can do?
देखिए, मूलभूत 3 बातें हैं जो यहाँ पर एनसीपी के नेता ने बात कही सोशल डिस्टेंसिंग की। सरकार की कुर्सी पर बैठ करके इस प्रकार की बातें शोभा नहीं देती। अगर लोग सोशल डिस्टेंसिंग लॉकडाउन के बाद भी अगर सड़क पे उतर रहे हैं, तो सरकार क्या कर रही है? आपकी पुलिस क्या कर रही है? अगर पुलिस से संभाला नहीं जाता तो सेना को बुलाओ, एसआरपी को बुलाओ। रोका किसने आपको? अगर लोग सड़क पे उतर रहे, आप खुद स्वीकार कर रहे हो, तो चुप क्यों बैठे हो? तो इसके लिए सत्ता की कुर्सी पे जो बैठा है उसके मुख से ये बातें शोभा नहीं देती। ये पहली बात। अब दूसरी बात, हम देखते हैं कि मुंबई और महाराष्ट्र के हालात बद से बदतर किस तरह से हो रहे हैं। आज लॉकडाउन का 63 डेज लॉकडाउन का आज पूरे हो गए। 63 डेज में मुंबई में इन्होंने दावा किया है बीएमसी ने कि हमारे पास 5,600 बेड है। आप मिरन नाउ की टीम भेजिए। आप जमीनी हालात ये है कि इनके पास 4,500 के ऊपर बेड ही नहीं है। और वो भी बेड कौन से हैं? जो पुराने अस्पताल थे, उन्हीं अस्पतालों में इन्होंने कुछ बेड ऑक्यूपाइड कर लिए। रोज के पेशेंट पॉजिटिव होते हैं 1500 से लेके 1800 तक, रोज के पॉजिटिव पेशेंट, मुंबई की बात कर रहा हूं मैं। और इनके पास 60 दिनों के अंतराल में केवल बेड है 5,600। अगर उनका आंकड़ा सच मान ले तो इन्होंने एक सिंगल बेड पिछले 2 महीनों में मुंबई या महाराष्ट्र में नहीं बनाया। जो बीकेसी की बात करते हैं वो हॉस्पिटल नहीं है, वो क्वारंटाइन सेंटर है, और वो भी केवल 900 बेड का है। वो उन्होंने गए हफ्ते उद्घाटन का नाटक किया, अब तक शुरू नहीं हुआ। आज के डेट पे शुरू नहीं हुआ है वो बीकेसी वाला। एनएससीआई का काम चल रहा है, 800 बेड का क्वारंटाइन सेंटर है। रेस कोर्स का 800 बेड का क्वारंटाइन सेंटर। हॉस्पिटल कहाँ बनाया? चाइना में बने हॉस्पिटल, देश विदेश में सब जगह बने हॉस्पिटल। मुंबई हुआन बन रहा है। इन्होंने क्या किया? दूसरी बात बता दो आपको, शॉकिंग, केसेस क्यों बढ़ रहे हैं? जो डॉक्टर साहब ने बात कही वो बात सच है, पर केसेस बढ़ने का दूसरा कारण ऐसा है कि जिस घर में कोरोना के कारण किसी परिवार के एक व्यक्ति की मौत हो गई, तो उसके बेटे को, उसके वाइफ को स्वाभाविक रूप से कोरोना पॉजिटिव मिलेंगे। उनको खांसी आ रही है, उनको बुखार आ रहा है, वो बीएमसी के पास जाते हैं, अस्पताल में जाते हैं, हॉस्पिटल में जाते हैं, किसी प्राइवेट डॉक्टर ने लिख दिया कि इसकी कोरोना टेस्ट करो, तो बीएमसी की ओर से उन डॉक्टरों को नोटिस भेजे गए कि तुम्हारा लाइसेंस हम सस्पेंड कर देंगे। ये आंकड़े छुपा करके बीमारी नहीं छुपती, ये आंकड़े छुपाने का खेल खेल रहे हैं इन्होंने।
ओके, ठीक है, एक एक इशू लेते हैं मिस्टर कदम, एक एक इशू लेते हैं। ये जो आपने स्टैटिस्टिक्स की बात करी है, हॉस्पिटल्स में बेड्स, आईसीयू बेड्स और वेंटिलेटर्स की, यहाँ पे मुझे भी डाउट है। क्लाइड, you need to respond to this. As of this evening, when we checked the government website, the data was completely, yes, I just want to highlight this. The data on the Maharashtra government website is completely different from what was given to us in the news briefing, and starkly different. There is absolutely no match between the data. Now, I don't know whether to believe the BMC or to believe the Maharashtra government. The Maharashtra government tells me that in all, there in dedicated COVID hospitals, there are 1,233 beds. In dedicated health center, there are 72 ICU beds, and I'm only counting ICU beds. In dedicated COVID centers, there is another set of 2 additional beds. In all, even if I add all of this, this roughly just comes to about 1,300 odd ICU beds. We are being told there are 8,000 ICU beds. Now, is this a mismatch between what the government is saying and BMC is saying, or are you just adding any number of ICU beds from different non-COVID centers as well?
Tanvi, now can I just talk here? Okay, I've been listening to what Mr. Ram Kadam has been saying, and I don't know, maybe language is the communication gap, or what I said he could not realize. So अगर आप चाहे तो मैं हिंदी में भी आपसे वार्तालाप कर सकता हूँ.
I understand. You go ahead. I understand.
Okay, Ramji. I mean, fair enough, because I always meet you and I talk to you in Marathi, so maybe I thought there was a communication gap. But ठीक है, I'll talk in English since it's an English. No. Okay. Sorry for that. Okay. Now the point here is there are 3 things he mentioned. Now, please allow me to talk, Tanvi. And like he was talking, I didn't disturb, so I know he will also not disturb me. Point 1, he said that speaking about social distancing. I'm not saying the onus is just on the people. We have to do it together. And when he spoke about one thing, he said, क्या तुम्हारी पुलिस नहीं करती है? तुम्हारी और मेरी पुलिस नहीं, it's our police. Our police is doing a good job. Secondly, he said, क्यों ना military बुलाइए, ये बुलाइए, वो बुलाइए. We have taken the help of the Central Armed Police Force. There are visuals. He knows about it. In his areas also, there are people who've been, the police force has been going there. All this has been taken care of. All these things are going on. I don't know whether, maybe he's just saying it because he's a BJP spokesman, but I'm sure he's seen all the visuals of how we are maintaining things in the city. And these things are going. He's doing his job. I'm doing my job. I explained this to you. But we have a central armed police force that is already there in the city, which is helping our police force because our police force is working very hard and they also need help, and we are supporting them with a central agency that has come to him. Second point, he spoke about, what he said was the beds that are not available, and in BKC, those are only quarantine centers. I mean, that's why I purposely, normally I don't carry lists because I say it right away, and it's all in my head. But I'll purposely read it, and it's also reported in your Mumbai Mirror today. There are nearly 1,020 beds in that BKC modular hospital that we made. It's a modular hospital. There are 504 oxygenated beds there. There are 100 ICUs there. Dialysis center. Phase 2 also looking at 1,000 beds. And if Mr. Ram Kadam thinks this is not an hospital, I'm sure he's an MLA. He can go there anytime and see. Nobody's going to stop him because he's an elected representative. He can go there and take a look at any time what you say. And then the third point what he spoke about was how doctors are being questioned and license will be cancelled. Nothing of that sort. This issue I have personally dealt with in my area also. The BMC has only told the doctors that only if you are sure can you go and test the people, because there is a certain protocol and the process that we need to follow while doing a COVID test. And those protocols have to be followed. And cancelling the license was only said in the context that they were not willing to open their dispensaries to help people. We made sure that they opened the dispensaries so that people can be treated besides the one who are suffering from COVID. There are other people every day which they have illnesses. So some doctors refuse to open their clinic. That's when the BMC went to the extent of saying that you need to treat the other people also. Life is not just right now COVID. There are other issues. People are suffering from a lot of other things that we need to take care of. So those are the things that we are talking about. Now coming to the point, Tanvi, what you spoke about, that the state government has one figure and the BMC has one figure. There is no confusion. The figures are every day coming out. Or of your team, which Mayuresh or Disha, they've been going out. They've been reporting. You can come. I will send you more details. I will send more details to your journalists. There's no confusion. When we say something, it is the way it is. There's nothing that we are saying. There's one figure and there is nothing out there in the reality.
No,
and if you think. No, can I just finish? Just one last thing, then I'll hear you.
So, Clyde, I am quoting from the state government data. No, but I am quoting from the state government data. That's what I'm saying. I am looking at the state government data.
Tanvi,
and there is no match.
Can I interrupt?
It's starkly different.
Can I interrupt?
Finish and then you can
say something?
Ramji. Yeah, let me finish, then you will. You are
talk. Clyde first, Clyde.
Okay, go ahead.
It's not. See, if there are discrepancies, if there are figures and issue, you bring it out to our notice and we will make sure that the right figures and the correction is done. There could be a little problem in the website right now. What we don't know, and I haven't seen it, what you're saying. I will go and cross-check and we will highlight it. You will get the figures the way it is.
Okay, so let's just say, by the way, this is what the BMC has said today. Again, I will reiterate the fact. Over 8,000 ICU beds and 3,000 ventilators. This is not what is there on the government website. Granted, maybe the government hasn't updated its data. In a day or two, that website data will get updated. Here is the BJP that's making an allegation that it's not even 8,000 ICU beds. But I will for now say, okay, this is what the civic body is telling us. Let's take this figure. I just want to go across to Dr. Shashank Joshi and ask him, Dr. Shashank Joshi, for the size of this city and the number of people here and the way the cases are continuing to go up and based on the data, I'm sure you'll agree we are nowhere close to the peak. So as of now, are we ready? Is this going to be enough in terms of preparation?
So Tanvi, I would like to disagree with you. I think we are at the peak. And I have told it before also that between 15th May and 30th May will be our peak. That peak might get shifted by another 15 days. So next 2 to 4 weeks is already our peak. And with this strict testing, tracing and quarantine policy of the BMC, we are going to see numbers which are going to wall up. So instead of seeing 1,500 cases per day, you might even see 3,000 cases per day. And the more cases we diagnose, detect, treat and isolate, the better it is for the long term of the city. Yes, we have a problem on hands. We have to face it all as united one team, and we have to strictly enforce not only just distancing but masking, as well as ensure that people are cared for and treated. A lot of our people fortunately are asymptomatic. A lot of them have started recovering, and many of them, only 8% of the total COVID population affected in Mumbai needs ICU. But that itself is a large population, because our biggest problem is the population density, and the urban slums, the social distancing is impossible. But I think we have to all work as one team, including the media, including the political parties and the medical professionals and the healthcare teams, to fight this battle. You are absolutely right that we are at the peak, and the peak will go beyond 31st of May right up to 15th of June. With monsoons hovering around our air, we have to be extraordinarily careful and ensure that every person who needs help gets help. But we need also people's cooperation. they have to distance, they have to mask, and they have to cooperate. I think that is something which is mandatory. And I think the healthcare workers are there. We have to ensure that at least now BMC was testing, but that contact tracing as well as their isolation policies need to get more and more stringent. I think they are getting it there now because this is a public health emergency. And the asymptomatic people, there is no need to panic. Most of you all are going to recover and you are going to be okay. It's only the vulnerable population or the extremely vulnerable population which needs attention and which needs facilities either in corona care hospitals or in regular hospitals. Our number of beds are finite. They have increased the capacity. Also, I think this distinction of COVID and non-COVID should totally stop, because of which a lot of patients are going from pillar to post.
Okay.
Every hospital, whether COVID or non-COVID, should accept and treat patients even as suspect COVIDs. There is no need for a COVID test to be treated. You need treatment, COVID, non-COVID, treat them, give them emergency treatment, and then do a COVID test. That policy, if we follow, we will still decrease the hardship of people at large who are facing in the city of Mumbai. And that is a cooperation which all of us need to participate in.
Okay, I want to bring in one example. Despite the fact that we keep saying we are adding more beds, we are adding more ambulances, 456 ambulances in the city from what we would have started off with 60 to 70 before COVID hit us. Here is an example from Mumbai. A woman lost her father who was in his late 60s after he was denied permission by multiple private hospitals in the city. This woman also claims that first she struggled to get an ambulance. She had to carry her father in a private cab from one hospital to the other because there was no ambulance available for treatment, and from one hospital to the other she was denied treatment, denied permission. Finally, one day later, the next day, she got admission for her father at the KEM hospital with a lot of difficulty. Within hours of conducting the COVID test, her father passed away. He turned COVID and the test came positive. Now, how do we solve this, Clyde? How do we resolve this problem? Despite the fact 3 weeks ago, BMC told us we've changed the policy. People with mild symptoms will now be home. This will free up the additional beds and it will solve the problem. The problem is still not getting solved.
You see, Tanvi, I heard what you said about this family who lost their loved one, and I don't know. I mean, when it comes to this, what do I say? I mean, this happened, and it's not right. I didn't. But there are, if you see other cases, there are times like yesterday. I'll talk about my personal thing. I was trying to help somebody out, and we had 3 ambulances who were ready to go immediately, and within 10 minutes there was an ambulance that took the person from Pate to Mulund for treatment. So there have been cases where within minutes the ambulances have been available. This happened. I mean, I don't know how to give you an explanation on this particular, because the case has already happened. But people are on the ground, they're working, the ambulances are there, the hospitals are there. There are a lot of people, certain places, beds are not, but somewhere or the other, the accommodation takes place and it's happening. Yes, lot more work has to be done. There's no doubt. The earlier doctor, I think doctor from the Leela hospital mentioned that it might, a lot of cases are coming in, but we are working, everybody's working on the ground, and it's not enough. I'm telling you, it's not enough. More has to be done, and we'll continue doing it. And if there's a case where the ambulance has not come, there's a case when you one call you've got done, and there are 3 people have called you back, and you need ambulance right now when you come? And I'll give an example because I experienced it yesterday. So these things are happening. A lot of work has to come. We have to fight it together. Everybody has to come together and do it. I mean, somebody lost their life. I'm sorry about that. And what more can I say? But there are other cases where things are happening, and we will try our best to keep trying. We will try.
No, I'm not, and it's not an isolated case that I want to respond. The idea is to show that day after day there are instances like that. You ask people even now. 2 days ago, a reporter was outside the KM hospital where people were sitting outside. They were actually just spending their whole day outside because there was no space available inside the hospital. So they would only go inside to use the washrooms and then come out again. And we had people on camera telling us this. I am simply saying, and Dr. Mangesh Pate, maybe you want to come in on this, that there are cities like Mumbai where the challenge is going to be big. And from day one, we have to, work on building the infrastructure. Now, as we see 1,000 cases 20 to 40 deaths being reported every day. What should be the priority? How do we ensure that this peak comes down while we save more lives? Dr. Mangesh.
After listening to all this long discussion from Honorable Shri Ram Kadam sir and my friend Dr. Shashank Joshi and Clyde, I'd like to make a few points here. First, coming to what you have asked just now. See, what is lacking here? Let us come to the ground reality, what happens. Suppose today I am a common person and I come positive or I am suffering from some COVID mimicking symptoms and now I have to get admitted to some hospital, myself or my relative. I really don't know now what to do. So I find out some vehicle, ambulance or something, and I roam around in the city from one hospital to other hospital to other hospital. There are many phone calls I personally receive every day that this one patient is there, he is not receiving bed. डॉक्टर साहब कहाँ मिल सकता है क्या देखो. मैं 10 जगह पे फोन करके देखता हूँ कहाँ कोविड का बेड खाली है क्या. So what is needed here right now is there should be one common central dashboard. So at one click, everyone should come to know where the vacancy is there. And that is not at all difficult. It is very much possible. Sometime back when I spoke about the vigilance, this dashboard is a part of that vigilance. Remember that. There has to be one war room, central war room to deal with this entire pandemic. The dashboard is a part of this war room and it should be open to every common man. Beds are vacant and where his patient can get bed for admission. This is point number one. Point number two, when we are speaking about the number of beds, let us not right now at this stage speak about the beds which are meant for the quarantine. This is the stage when we speak about the beds which are meant for the high dependency unit and the ICUs, because that is going to be the stage what people are going to need right now, not the quarantine. Already we are done with the institutional quarantine and we are already advising people home quarantine, even the asymptomatic or pre-symptomatic positive cases. Another 3 points, please allow me to speak.
Okay.
There are one or two sentences. Yeah, please. Can I speak? Hello?
Yes, please.
Yeah, Tanvi. Yeah, there are one or two incidences where doctors were issued notices by the Mumbai Municipal Corporation for sending COVID test. That notice is right now with me also. I want to just make one simple statement here. To test for the COVID or not to test for the COVID in any patient is a professional right of the doctor. It is a clinical acumen of the doctor. Try to understand. No one is having any hurry of sending tests to every Tom, Dick and Harry, but it is doctor's clinical acumen. He uses that this patient might be mimicking a COVID symptom or he might be coming out from the containment area or red zone. So this patient needs to be tested. That time doctors. Only thing what should be done here, doctor should mention proper history when he prescribes the test. That is something which is ideal. But no doctor should be sent notices as far as the COVID testing is concerned. That is a professional right here. Another very small point I will make here, that something was mentioned about the closing of the hospitals and clinics which was mentioned, these notices. I will just like to bring you all out of Mumbai, just periphery of the Mumbai. There are notifications to the private clinics, private doctors, private hospitals that from your hospital, from your clinic, please provide 2 sisters, 3 sisters, ventilators and whatever necessary equipment for the running of the HDU and ICUs of the COVID specific facility. So that means private doctors and hospitals, they are providing their expertise, their skills, the staff nurses which are working there, as well as the equipment which is necessary to handle the COVID ICU and high dependency unit. When private hospitals and doctors, they are doing so much of this thing, why unnecessarily this is time and again said that private hospitals and doctors, they are not cooperating at all. The problems why few private hospitals and clinics, they are closed is because either age limit of that doctor is a 60 or 65 plus, he is senior citizen. Second thing, most important, the staff nurses and other staff which is working in the hospital, they are not coming on duty because of the lockdown. That is the biggest problem. Otherwise, no doctor, I assure you, on behalf of all doctors, no doctor will run away from this COVID duty. That is the point I want to make. Thank you.
Okay, I just want to get closing comments from Mr. Clyde, but before I go across to Mr. Clyde Crasto, I also want to bring in the BJP MLA, Mr. Ram Kadam, and get a response from him. Mr. Ram Kadam, you wanted to make a point earlier. Go ahead, please.
देखो तन्वी, एनसीपी के नेता यहाँ पर कुछ भी दावे करे, जमीनी हालात ये है कि इन्होंने पिछले 2 महीने में जो अरेंजमेंट करनी थी कोविड से लड़ने के लिए, वो अरेंजमेंट 2 महीने के भीतर कर ही नहीं पाए। जो बीकेसी की बात करें, वो क्वारंटाइन सेंटर है। खुद मुंबई की डिजास्टर टीम क्या कह रही है वो देखो। और कोई भी मरीज, आपकी मिरर नाउ की टीम भेजना, किसी भी अस्पताल में जाइए, एक सिंगल बेड खाली नहीं है। और रोज के 1800 पेशेंट पॉजिटिव हो रहे हैं मुंबई में। लोग तड़प करके घर पे मर रहे हैं। अब मैं 3 टर्म का एमएलए हूँ, रोज जो मैसेजेस आ रहे हैं, जो लोगों से बातें हो रही है, लोगों को कहीं पर भी अस्पताल में जगह नहीं। जो डॉक्टर मंगेश जी ने कहा, दैट इज एब्सोल्युटली ट्रू। ये डैशबोर्ड की बात देवेंद्र फडणवीस जी ने 2 महीने पहले कही है। महाराष्ट्र सरकार को अगर सूझबूझ होती तो डैशबोर्ड पे इन्होंने क्यों नहीं डाला? क्योंकि इनके पास बेड ही नहीं है, नहीं डालना चाहते हैं डैशबोर्ड पे। अगर डैशबोर्ड में डालते तो लोगों को तकलीफ नहीं होती। लोगों की लाशें रखने के लिए जगह नहीं है, इतना इनका फेलियर है। और फेलियर को इन्होंने स्वीकार करके हम चाहते हैं कि उसमें सुधार करें, गंभीरता से इस कोविड के बारे में ध्यान दें। दुर्भाग्य से पिछले 63 डेज में इन्होंने 63 पैसे का भी मुंबई या महाराष्ट्र को पैकेज नहीं दिया। मुंबई की 3000 एम्बुलेंसेस बंद है, ये क्यों छुपे सरकार करके? मुंबई के सारे क्लिनिक्स बंद है, 90% क्लिनिक्स मुंबई के बंद है। अब बारिश में सर्दी जुकाम होगा, लोग कहां जाएंगे? सरकार क्या कर रही है कार्रवाई? महाराष्ट्र के वही हालात है, हर घर में भुखमरी आरंभ हो चुकी है। सरकार ने क्या किया पिछले 2 महीने में? टीवी पे आते हैं, मीठी बातें करते चले जाते हैं।
ठीक है। मिस्टर कदम, समय की कमी है, इसलिए मैं जल्दी से क्लाइड को बोलती हूँ आपको जवाब दे दे इसके लिए, जिसके पहले कि मैं डिबेट खत्म कर सकूं। क्लाइड, respond to this, the delay in action.
Yes, quickly,
announcements that are happening should happen 3 weeks, 4 weeks before they're made. Yeah.
See, I'll quickly, Tanvi, see, I don't want to politicize this, but let me tell you one thing. Your channel has been highlighting everything that we've been doing in the last 63 days. Okay, whether you think it's correct, wrong, everything is there out in the open. I just want to tell the people who are watching your channel and listening to you that the kind of fear mongering that Mr. Ram Kadam just put in everybody's mind, that ye nahi hai, wo nahi hai, ye kaam nahi kiya ho raha, please don't fear. Please don't be afraid. It is not as bad as what the BJP spokesperson is saying. If you want, you can come out in the open, and Mr. Ram Kadam also can come out. Sorry, no.
But that's not the answer. That's not the answer, Clyde. There has to be accountability. There is merit to the fact that you are starting a dashboard today for availability of beds. That should have happened a month ago. That's what I'm saying. The additional ambulances, the additional ICU beds, the additional ventilators, why are we moving so slowly on that?
Slow, Tanvi, you can come out. Your team is there. Your team is there. Your team has been out on the field doing a fantastic job. They have been highlighting everything. My humble request to everybody is that in these times of that people are suffering, let's not spread fear mongering. Mumbai is not suffering the way it has been highlighted by certain people. There are issues, there are problems. We are working on it. We will continue to work on it, and Mumbai will be out of trouble soon, is what I want to say. And I don't want to politicize this further.
It is not question of fear mongering. It's a fact. Whatever the numbers I have given, that is a fact. You can't deny that. You can't deny that. Your government has not done
it's not fear mongering. The idea of highlighting these problems is to say we need things to change. It's not just 2 months. 2 months is a long time, Clyde. We've been in a lockdown so the government can get its infrastructure and support system in place. Otherwise, we will be constantly in a phase of lockdown because we are not ready to open up. Other cities are opening up, businesses are starting. We cannot afford to do that right now because we are not ready to handle it. It's not just one case that we have highlighted. I was telling our viewers, from KEM hospital, patients told us how they had pneumonia, no place inside, no beds available inside. People are sharing beds. Others are sitting outside under the tree in this heat. They only go inside for their injections and the treatment medicines, and then they come and sit outside. People are still struggling for ambulances. There is still a problem of bed. Now we are being told a week ago that private hospitals are being roped in. Their beds will be taken over. These things need to happen at a faster pace. We can't be playing catch up in Mumbai or Maharashtra. We need to be ahead of the curve. We need to be one step ahead so that tomorrow when there is another spike for 1500 cases and 2000 cases that start getting reported, we are able to handle it. This is not fear mongering. This is just plain basic better preparation to beat coronavirus. That's all. A big thank you to all of our panelists for joining us on this conversation. Thank you so much. Welcome back, viewers. It was day 2 of domestic air travel here in India. Unlike day 1, where there was massive chaos at outside the airports and in the airports because of flight cancellations and rescheduling and delays, day 2 was much better because by now people whose flights have been cancelled, and a lot of them have been cancelled, had already been informed. Now, all of this happened because only on late Sunday night did the centre decide, at the request of several states, that we cannot operate full-fledged operations. To begin with, there will be limited flights to cities like Mumbai, which is why there was a lot of confusion. I don't want to sit and talk about what is going to happen in the next coming days. We'll wait and watch. But we do want to take this opportunity to talk about precautions, to talk about what to do if you need to travel. And let's face it, viewers, COVID is here to stay. Coronavirus is not going away for months together. It isn't as if the lockdown gets lifted and the airlines begin to function, life is back to normal and we can travel as usual. We can't. So what is it that we should keep in mind? That's what I want to talk about, and I've got a very special guest joining us from the University of Washington. But before that, I want to go across to Wajiullah. Now, Waji traveled for us from Delhi to Mumbai yesterday and back. And he got us interesting insights into how things function at the airport. Waji, what caught my attention was what happened, I believe, on your way back. Just as the aircraft landed, people were up and about, queuing up, pretty much pouncing on each other, ready to get out of the aircraft, just like we do in normal times. That visual actually has had quite an impact on many people, because this shows that social distancing can completely go for a toss if people are not careful. Now, tell us if there were other such instances that happened. Even at this point of time, why were people in a rush?
Well, Tanvi, as we all know, everything has completely changed with regards to in the times of COVID-19, and traveling was one such thing. We showed you how things have changed completely, and we've also shown how things that you have to follow while traveling right now. But the visual that you are talking about is something that is very interesting, and it was really shocking when it happened right in front of my eyes also, because it was something that we all were aware of. We all knew what times we are living in. And when we landed at Delhi yesterday, we saw everybody just get up like it was normal and nothing had really happened, and there was no form of social distancing. The airlines, as we were traveling in, was also in full capacity, and they were also baffled by the way in which people got up all of a sudden despite their announcements. But this scene is something that is really unprecedented, and it is a prerogative of the people also to realize that they should follow some rules with regards to getting down or deboarding planes. And it's also a prerogative of the government to find some SOPs where they can say that it is the first row that leaves first or the second row, because we are all become a part of queues now. We are all handing in queues. We are making social distancing, and that should be followed while traveling also. And this was one thing. But from what we've seen today was less chaotic. Today, the government is trying to inform people in advance about things that are happening. They're trying to maintain that there is social distancing at the airport. At the airport, there was social distancing, but in the flight, when we moved in, it wasn't. In the flight that we came in also was a packed flight. We had 3 people sitting next to each other. So it is something that now it's on the hands of people to also make sure that they restrain themselves from crowding clusters, they restrain themselves from being a part of crowds or gatherings. So this is something that it's now in the hand of people. And this video that we posted yesterday was something really shocking, and it has also gathered a lot of attention. But from what we've noticed today we've not seen any such incidents where we've seen crowd, but we've realized that the government has taken note from their experience in the last 2 days and is doing these changes. And in the coming days, we'll see more and more such changes coming by.
Well,
Thank
I
you.
don't know what more can the government do in this case unless they just drastically reduce the number of people in each aeroplane and each aircraft. Vaji, thanks so much for joining us. But some amount of this responsibility also has to come from people. I don't know who was in a rush at that point and what really did they gain by standing, jumping, into that line inside the plane, rushing to get out, completely forgetting that these are times of a pandemic and we need to maintain our distance. Just to also let you know, viewers, the first case of somebody who traveled yesterday has already emerged. Now, this is a passenger who was traveling from Chennai to Coimbatore, and upon arrival at Coimbatore, when he was tested, and the test has now come today and he has tested positive. Now, there is a lot of screening that's actually taking place in Tamil Nadu. They have very few flights also which are flying. The first instance of a COVID positive passenger has already come out now, which is why you need to be extremely careful, because you will never know if the one next to you or in front of you is actually carrying the virus. Now, you can wear the mask and wear your gloves, but you have to maintain your distance as well. To get you more insights into how to really design your travel life around this issue, I've got Dr. Ramanan Lakshminarayan, affiliate professor at the Global Health at the University of Washington. He's also director and senior fellow at the Center for Disease Dynamics, Economics and Policy. Dr. Lakshminarayan, thank you so much for joining us again. Always a pleasure to have you. Good morning. We're just trying to understand the fact that corona is not going to go away also means that some of us will have to undertake some important urgent travel. Now, what should one keep in mind when we're out there in public places and traveling, air travel or road or rail?
Well, the thing to remember is to maintain a balance between respecting the virus and not fearing the virus. I don't think we should live in utter fear of this virus. And I think to keep in mind is that most people will not actually be affected by coronavirus. And we're doing all of this for a particular age group, which is the elderly population. And that's the thing to always keep in mind. Now, it is hard for the government to make precise rules that work in every situation. I think they're doing their best. This really comes down to civic responsibility. And when we don't have civic responsibility in the best of times, we can't really expect civic responsibility when times are, uncertain as well. So, these are things that we should all be practicing anyway in terms of not rushing up when the plane lands. And we see that even under normal times when people will get up, even when the plane has not come to a complete stop and so forth. So I think this is a time for people to actually exercise that behavior themselves and also, hope that people around them will exercise that behavior, because this is a collective problem. Any one person behaving irresponsibly on that plane who is COVID positive could potentially give the disease to many other people all at the same time. So we are at the mercy and safety of what other people do, and vice versa. Their health depends on us. And I think that is the social contract that we have to really understand. There's only a limited amount that you can protect yourself. By all means, wear your masks, carry your hand sanitizer, make sure you have a shower as soon as you come back home. But a lot really depends on people just exercising restraint and knowing that, listen, rushing out of the plane 2 minutes early to get on that bus where you're going to be crowded anyway has really no benefit at all.
Yes, in fact, just the fact that in a country like India, the challenge is bigger because of the population and the density everywhere you go, whether you're traveling in a bus or a train or a plane, there's always going to be a lot of people around. To which the question then comes that what should be on top of our mind? Is it to ensure that we don't touch anything, just completely stay away from all surfaces? Should people be disinfecting or using sanitizers on their armchair, on the arms of the chairs and the seat belts? To what extent do you go? Because you mentioned it very rightly, there has to be a balance between respecting the virus and not fearing it.
Well, I would say that, listen, the honest truth is that almost every act of going outside has some risk. And this is the same as, you go cross the road. There's some risk that there will be, some car that might hit you. But we still are used to these risks because we can understand these risks, right? So you understand what the risk is of crossing the road, and you understand what the benefit is of crossing the road, etc. So most risks in our life, we have a good handle on. The problem with COVID is that none of us, no expert really even has a good handle on the risks. we actually don't know. We really don't know if sanitizing that armrest makes any difference at all. We don't know any difference. We don't really know if wearing those gloves make a difference, because it's possible that you touch something with the outside of your glove and touch your face, and then you're infecting yourself. This is the reason for the confusion around the masks. What I would then say is that don't look for something very definitive and concrete, because the honest answer is we don't know. Undertake common sense precautions. Please don't panic. Undertake common sense precautions. Try to stay away from people, maintain a little bit of distance from people, and, just take it easy and take a deep breath and calm down and travel calmly. And I think that's the only thing to say. I can't sit here and pretend that we actually know exactly what measures would make travel completely risk-free, because the act of traveling itself involves a risk. But there's a benefit to it. We might be going to see our mother, or we might be going for a business purpose, and therefore we're undertaking that risk like we do everything else in life. So I'd urge people to just exercise common sense, and really, that's all we can do at this stage.
Yes, in fact, to the point that you were making, it's the same when you go out for your regular shopping, for your grocery shopping, or if you're going to the supermarket, stuff that we may be touching, and the number of hands it may have changed. There is only so much precaution that the entire supply chain is going to be taking. And so there is some amount of exposure risk that will always remain. But like you rightly said, there is some amount of precautions that we can take. For example, not rushing to get out of the plane the minute it lands or hits the runway is one of those things that people have to keep in mind. Here in Mumbai, in fact, we've seen a lot of instances. The minute shops have opened up, people have just rushed out and completely forgotten about social distancing. Is there also, as cities open, is there also an important policy aspect to this in terms of when should the markets be open? Should there be staggered timings for movement, for businesses, for offices? That kind of a broader thinking?
Well, staggering definitely helps, but there are consequences of it as well. To the extent that it is possible in markets, because keep in mind, again, going to the biology of the disease, many people don't transmit COVID at all, even if they have the disease. But some people, and we don't know who they are, they might even be asymptomatic, might transmit to a lot of people. So it is not as if we know that every person who is COVID positive is definitely giving it to 3 people who are, who are COVID negative. That's not the way in which it works. That is why the lockdown is imposed. That's the reason why we're trying to maintain the social distancing, because we actually don't know. As you said earlier in the program, that person sitting next to you who's showing no symptoms at all could be carrying the virus and can easily transmit it. There is no way for us to know, which is why it's good for all of us to exercise these precautions. It's for a 6-month period. It seems like a long time, but it's for 6 months, and it's for the country's benefit, because if we do it, it is not about us getting sick. That is not the biggest deal. It just means that the epidemic will slow down because of these small actions that each of us take to slow down the epidemic. And I think we've done a good job so far. We've got much slower growth of the epidemic, but post-lockdown, without policing, without a policeman telling you, stay inside or do something, it's going to be entirely up to our individual behavior that determines how this epidemic is going to grow. So to that extent, there's a lot of individual responsibility upon ourselves, and I don't think the government can do much beyond a point. They have to do their testing and making sure that ICU beds are set up and so forth. But they can't tell us to maintain distance from each other on a plane. I mean, we're not children. We need to know that.
Well, thank you so much. Always a pleasure to have you. And, some of the points that you raised are extremely important that people must keep in mind, including the one that even if they are carriers, they may not necessarily pass on the infection. Yet there are some things we have to keep in mind, viewers. We cannot forever be locked down in our rooms, in our homes. We have to start stepping out at some point. When we do, let's just keep it in mind that Corona hasn't gone away. We just have to find a way to live with it, to take precautions, and maybe at some point we will find a solution and a vaccine for it. Dr. Lakshmi Narayan, thank you so much for joining us here on the broadcast.